May I now request Mr. Tohuku T. Sema from Dimapur district to come and take the award. Currently, he is supporting 20 number of TB patients. Thank you, sir. May I request our Honorable Chief Minister to kindly take the podium for the speech.
Respected Srila Unison, the Honorable Governor of Nagaland, my Honorable colleagues, Mr. Y. Patel, Deputy Chief Minister, Sri G. Paito, IA, and Sri B. Paiwang, Minister for Health and Family Welfare, respected Chief Secretary, senior officers who are present here, health workers, awardees, blood donors, ladies and gentlemen. I, on behalf of the state of Nagaland, joins the nation in thanking the Honorable Prime Minister of India for launching the Ayushman Bhavah situation coverage of health scheme. And I congratulate the Honorable Prime Minister and also appreciate for his visionary leadership to make our country healthy and wealthy. I also congratulate the Ministry of Health and Family Welfare, Government of India, and I am grateful to our Honorable Governor, Srila Edison, for launching the Nagaland chapter. Indeed, it is a proud moment for the country and also for a state like Nagaland, which is backward and much in need of health facilities. I'm confident that the launch of this program will bring us closer to the objective of leaving no one behind and healthy villages basing on that principle. This is an important component. Sustainable Development Goals 2030. And there is no doubt that a healthy population will be more productive and help the government to save sustainable farming. The move to saturate PMGAY, the scheme, and create awareness through health melas, setting up of village level and ward level sabas, which surely have positive impact through a wider level of participation of the people. Under the Ayushman Bhavah Pradhan Mantri Jan Yojana, scheme will all schemes, all the beneficiaries, especially those residing in the interior, rural areas, can avail cashless healthcare benefits up to 5 lakhs per family per year. Distribution of PM-JY cards to the remaining beneficiaries will help to bring healthcare coverage to everyone. Knowing very well the huge burden of medical treatments on the people with low income, as well as the complex and difficult procedures for claiming reimbursement. During last budget, announced the introduction of Minister Health Insurance Scheme to provide a cashless treatment for all state government employees and pensioners up to maximum of 20 lakhs per year per family. We have also extended coverage to all the citizens of the state up to maximum of 5 lakhs. Since this project has been launched today, we will have further review for our citizens to get the full benefit. Today, CMHIS is being implemented in convergence with the PM-JY. This will bring the entire population of the state under health insurance coverage. Besides providing cashless treatment in a convenient way, health insurance is covered, instrumental in mitigating the risk of impoverishment resulting from hospitalizations expenses, and promotes access to quality healthcare services and accelerates state progress towards achieving whose sustainable development goal of universal health coverage and Nagaland Vision 2030. I'm also pleased to note that other activities including prevention and control of tuberculosis and malaria to meet the goal of eradication, then by 2025 and 2030 respectively. There will be also focus on attention on HIV and AIDS, dengue and typhus in view of their high incidence in our state. I take this opportunity to urge all the village councils, ward panchayat, and health committees to extend their fullest cooperation and to spread the message of the importance of cleanliness and hygienic habits to reduce the spread of dengue. Also appeal to all the citizens of the states to come forward to donate blood to save lives. We need to create awareness about the myths and misunderstanding about donating blood and encourage all healthy persons to come forward to donate blood and save precious lives. I thank the Honorable Governor for his kind presence and launching Ayushman Bhavah campaign program, launched from his historical hall of Raj Bhavan, Kohima, and also for the opportunity given to me for sharing the various initiatives that are being taken for ensuring healthcare services for all with the participation and cooperation of all stakeholders. Thank you and Jai Hind.
Thank you, sir. We shall now take the pledge for organ donation, for which I call upon our Principal Director, Health and Family Welfare, Dr. Ritu Thur. Shall we all stand? Shall we put our right hand over our heart to take the pledge?
I take a pledge to donate such of my organs and tissues as could be used after my death to give lease of life to those in need, keeping in view the shortage of organs and tissues for transplantation in our country. I also pledge that I will make all efforts to inspire my family, friends, and fellow citizens to donate organs after death. Thank you.
Next seated. Be a champion, be an organ donor. For organ donation, you can visit www.organdonor.gov. We shall now have the award distribution for voluntary blood donors.
Blood donation is a noble act of altruism. Blood donors are lifesavers who selflessly donate your precious blood to needy patients whom they might never meet or know. Today we would like to acknowledge some of these blood donors who have donated more than 20 times. We have 13 individuals. The names are as follows: Mr. Rakesh Kumar Jain, Mr. Banda Song, Mr. Seketuzo, Mr. Ali Poker, Mr. Vincent, Mr. Sukumwati, Mr. Imnamau Longchar, Mr. Longra Kumbal, Mr. Y. Kaba, Mr. Bandang Kamsa, Mr. Tsuwang Fanan, Mr. Jayanta De, Mr. Apu Roy. May I request our Honorable Governor of Nagaland, Shri Lal Ganeshan, to kindly take the honor to give the award to the blood donors who are physically present here with us today. First, I would like to call Mr. Rakesh Kumar Jain. Rakesh Kumar Jain has donated 48 times. He is a social worker of business and businessman and engaged in social organizations. Presently, he is the charter president of Marwari Yuva Manch, Dimapur. He is also receiving a certificate along with a donor spin. Next is Mr. Bandang Insong. He has donated 30 times. He is a social worker and the founding General Secretary of Voluntary Blood Donors Association, Kohima. He will also be receiving a certificate and donor spin from our Honorable Governor. Next, Mr. Seketuzo. He has donated 34 times. He is a retired teacher. He says that my blood donation is an indication to God of my thankfulness to Him for giving me a good health. He will also be receiving a certificate and donor spin from our Honorable Governor. Mr. Ali Poker. Mr. Ali Poker has donated 25 times. Presently, he is working as Assistant Director, Nagaland State AIDS Control Society, and also the State Nodal Officer, Blood Transfusion Services. He is the founding President of Voluntary Blood Donors Association, Kohima. He is also receiving a certificate and donors fee from our honorable government. Number 5 is Mr. Vincent. Mr. Vincent is an O negative blood donor who has donated 20 times. He is a very important blood donor as negative blood groups is very rare. We wish him to save many more lives in days to come. His wife, Mrs. Seyenyo, Martha, has also donated 9 times. He is also receiving a certificate and donors fee from our honorable. Thank you all for your precious gift of life, and I would like to request our governor to kindly take the podium for a speech.
Honorable Chief Minister of Nagaland, Shri Nepuriu, Honorable Deputy Chief Minister, Mr. Y. Patel, Honorable Minister Health and Family Welfare, Shri Paimon Konya, Honorable Minister Mr. G. Koitoi, Honorable Minister Sri Metsibu Devi, Honorable MLA Sri Ayushman Bhavah, the Chief Secretary of Nagaland, senior officials of the state government, distinguished guests, invitees, dear Nikshay Mitras and blood donors, sisters and brothers. I remember an incident long back. I think it may be more than 30 years ago. I attended a program in Chennai, Tamil Nadu. It was meant for encouraging organ donation. Of course, blood donors were there, eye donors also were there. Dr. Badrinath, a very famous eye surgeon of Tamil Nadu, he spoke on that occasion. Well, I get forms to offer my eyes to others after my death. Eyes can be donated only after the death. But I don't get eyes. I get only forms, but not eyes. There, one of my respectable senior, Shivaramji, was there in the meeting. He thought, why the doctor said that he is getting forms, but not eyes. Then he decided, we have to enroll not individual, family. Suppose a person offers his eyes, especially about eyes. The entire family now, adults, entire family now we have offered our eyes after our death. So then they will give a certificate and that will be exhibited in the house. The whole family has offered. And because of that, somebody suppose dies, immediately other family member, he informs immediately, because within some few hours, in front of hours or so, I don't know exactly, the doctors will come and take the eyes otherwise it will not be useful. There was a blast in Chennai. One of my friend, he lost his life. Then it was informed to the family members and other people also. I was there very much in the hospital. His dead body was there. His sister came crying, knowing that the brother is dead. But the moment she entered into the hospital, she said, whether the eyes have been taken, eyes have been taken. Everybody was surprised. An accident took place, the bomb blast actually, and that fellow young boy, he died. And sister was informed, sister rushing, crying like anything, but the first question she asked was whether the eye has been donated. Because that particular boy, that particular youth, he was very much interested in canvassing for the eye donation. So that is why I suggest instead of going for an individual, hereafter my suggestion is enroll the family. This family has decided to donate the eyes. So this was what I wanted to say in the beginning itself. I extend my warm greetings to every citizens of our state on this occasion of the launching of the Ayushman Bhavah campaign in the country as well as our state. It gives me immense pleasure to address you all on this auspicious occasion, as it is a revolutionary initiative aimed at providing healthcare access to every citizen of our country. Healthcare is a fundamental right of every individual, and it is our duty as a welfare state to ensure that no citizen is deprived of this basic right due to financial constraints. Time and again, they have been emphasizing on the importance of health service for the growth and progress of our beautiful state. Ayushman Bhavah is a step towards achieving this goal, and I sincerely hope that it will give a huge boost to the health service delivery in the state of Nagaland. Under this scheme, individuals and families will have access to a comprehensive health care package that covers primary, secondary, and selected tertiary care services. This includes hospitalization expenses, surgeries, diagnostic tests, and even critical care treatments. The scheme seeks to alleviate the financial burden on families during medical emergencies and improving their overall well-being. Ayushman Bhavah is not just focused on financial assistance for health care. It is a transformative initiative that aims to strengthen the healthcare system of our country and our state. We have partnered with a network of hospitals and healthcare providers to ensure the highest standards of care for our beneficiaries. The scheme also promotes the use of technology for seamless access to healthcare services and transparent monitoring of the scheme's implementation. We need to take all health schemes of the Government of India to the doorsteps of every citizen. We have the Ayushman insurance scheme to provide comprehensive health coverage to our country's low-income families. And our own states, our Chief Minister's health insurance scheme. See, every family has been given per year, they are allowed to spend 5 lakhs rupees in any private hospitals, any hospitals. For a family, per family 5 lakhs. That is from the central government, our state government also has also scheme. The CM's health insurance scheme. One special feature of the scheme is that a beneficiary can avail benefits from any public or empaneled private hospitals across the country. We also have the Jana Aushadhi scheme that ambitions to make available to all its citizens quality and affordable price, generic medicines to all sections of the society. Compared to medical shops, these shops are functioning everywhere. Even I have seen in Nagaland also. During my tour, they hold Jana Aushadhi ke liye. So compared to other medical shops, this will be, the rate will be reasonable. Then we have the Ayush scheme that reflects our country's rich cultural heritage of traditional medicine. The other hand, normally all the medicines that generally people now they believe is the so-called English medicine, allopathy. But our country, from Charaka, from Sushruta time, long back, we were masters in healing, giving treatment to the people. So those systems also have been encouraged. Then we have the ice cream that reflects our country's rich cultural heritage of traditional medicine. It is an initiative of the Government of India to promote and regulate the traditional systems of medicines and integrate into the mainstream healthcare system. The central government, under the Pradhan Mantri TB Mukta Bharat Abhiyan, endeavors to eliminate TB by 2025. That is 5 years ahead of the global target. TB treatment is available free of cost at government health facilities. We have to enhance awareness about these various schemes. All these schemes have been started by the central government with a vision towards achieving universal health coverage. I urge every citizens to take full advantage of this scheme and register themselves and their families for Ayushman Bhavah. The government is committed to providing quality health care to all, and Ayushman Bhavah is a significant step towards achieving this mission. I am also happy that today we are also recognizing the efforts and contribution of Nikshaya Mitras and blood donors. Because the TB patient, they not only require medicines, the problem for the TB patient is they have to take more healthy food, which they cannot afford to, mainly the poor people or middle class people. And that is why they have to seek the help of the Mitras. So somebody gives 500 rupees. You can take care of a family. You take care of a person, TB patient. So I am very happy that Diksha Mitras have also been enrolled in this stage. During my numerous district tours, one thing I have noticed is not many are actually aware of the various programs like PM TB Mukta Bharat Abhiyan or the Diksha Mitra program. I don't want to blame you, even that it should be propagated more, that is my intention, not to discourage you. So, education awareness play a crucial role in promoting health and also the various welfare schemes meant for the people. We need to have more engagement with the community and organize more health camps and awareness programs to educate the masses. We have to empower our people with information so that we build up an aware citizenry that can take care of its own health. I would like to extend my gratitude to the central government, the state government, healthcare professionals, and all those involved in making this scheme a reality. I urge all citizens, civil society organizations, and private sector entities to actively participate in making Ayushman Bhavah a success. Together we can build a healthier and prosperous state and nation. Once again, I thank everyone for partaking in this momentous occasion as we come together to make Ayushman Bhavah a success story for the health and well-being of our citizens. I think compared to the age group, the people those who are sitting here and myself, in the end I can say, all of you, Ayushman Bhavah. Thank you, Jai Hind.
Thank you, sir. With this, we come to the end of our program. Shall we all rise for the national anthem? National anthem. Time is given for photo session, after which I request all to kindly proceed to the banquet hall.